Today I'm going to talk about what is penile implant surgery and what are the myths about penile implant surgery and the types of implants which are used in this surgery. So, first of all, penile implants are the end result for erectile dysfunction and it is a permanent and lifetime solution for erectile dysfunction. Once you do a penile implant, then there is no need of you to depend on any medications for a sexual act. For a penile implant surgery, I will tell you how we are doing it here. So basically, if you are planning for a penile implant surgery and if you are visiting us, first of all, we do the basic investigations. And once the basic investigations are done, we try to do the surgery on the same day so that the next day by evening you will be free, and if you want, you can leave there. But usually, if you want to stay for 1 or 2 more days, you can stay with us so that you can go back home comfortably. And by fourth or fifth day, you can resume all your normal activities. Only your sexual activity, for your sexual activity and the masturbation, you have to wait for 6 weeks from the day of the surgery. Now, there are a lot of people asking us, so after implant, how will my sexual life be? So, first of all, the sensation, the orgasm, and even the blood flow which is coming into the penis will be the same as the before. Before, when you are feeling a arousal or when you are feeling a sexual desire or sexual emotion, the blood comes in and you will get an enlargement in both length and girth of your penis. But after the implant, only the girth enhancement will be there. As the blood comes in, you will experience the full tightness which you achieve at the full erection. The length will be the same as before if you are planning for a malleable implant. So now, what are the implants which are available in India? So there are FDA approved implants which are available in India, both in the malleable and the inflatable. So first of all, this is the most commonly used malleable implant. This is the Indian implant and it's a very cheaper implant. So many people used to go for this implant and it gives a wonderful result. So with this implant, two implants will be inserted into your penis of the bilateral corpora. So once you bend the penis with the help of the underwear, you can conceal it, but once you remove it, it will become straight. So this is with the Indian implant, but there are good bendable imported implants which has good malleability. So this is a tube promodon implant, which is a German implant, and for the Indian subcontinent and some more Asian countries, this implant comes with a lifetime warranty. It is one of a good implant. I had used it for a lot of patients, and it has different sizes, so we can give a best result for you with this implant. So this is also one of the good implant. If you are planning for a malleable implant, you can consider this also. The next thing is the Tactra, which comes from Boston Scientific. It's an American implant, and it is one of the hardest implant which is available in the market. If you want a very rock hard penis, then the implant you should consider is this implant. But it comes with the disadvantage of little lesser concealability compared with the other implants. But this is also one of a good implant which we are using. This is a Zephyr implant. It's a Switzerland implant. They also comes with good concealability. One more advantage with this implant is we can trim this implant in both the proximal and distal size, and it has a hydrophilic coating. So hydrophilic coating means we can coat the implants with 3 to 4 antibiotics so that it gives a better result when used in a diabetic patients to reduce the chance of infection. The next is the Rigicon implant. So this is one of the implant which many of the patients, which is much familiar among the patients. So they come and ask us like, we wanted to go for Rigicon implant. So this is also a good implant with lifetime warranty, and it has a hydrophilic coating. So we can nicely coat the implant, and it reduces the chance of infection and which reduces the chance of infection, and even in immunocompromised patients we can use this implant. So the third thing is the inflatable implants. These are the inflatable implants. So it has two cylinders which will be placed into your penis, and this is the pump which is placed in the scrotum, and this will be the reservoir which will be placed into the abdomen. So I will show you how this implants works. So usually in India, we have two FDA approved brands. One is the Boston Scientifics, which comes as AMS 700, and one more is the Regicon, which comes as Regicon Inflaten. It has two variants. One is the normal implant, and one more is the anatomical expansion or the length and girth expansion. So I will show you how this works. So in this, one is the normal inflatable implant, and one more is the length and girth expansion inflatable implant. So now I am pressing the pump, which will be present in your scrotum. You can see the difference which is happening in both of the implants. You can see in one implant, the length and girth are getting more expanded because it has a polywoven silicon, which means the silicon can expand. So in a person who needs a enhancement in the length and girth can go for the anatomical expansion implant. The other person can go for the normal implant. So these are the implant options which are available in India and even with us. So usually what I do when you are coming for implant surgery, I used to show you all the implants and you can see the implants and you can personally feel the implant. Because once the surgery is done, these implants will be with you for your life. So I always suggest you see, feel, and whichever implant you want, you can choose. So we can do the surgery for you. And usually, according to me, the implants, once it's done, it should be there with you for life, because we don't want, you and me don't want to do a revision surgery. So it's always better choose it before going for the surgery. Thank you.